Hi, so I just wanted to ask you some questions about home health. I'm pretty curious about all of it, and I don't quite understand everything, so
Yeah,
is it all right if I just ask you some
yeah,
questions?
go for it. Let's get started.
Sweet. So could you describe some of your background and your experience with this setting? Like, how did you first get into it?
I was a traveler at the time, and a great company, Mercy in Muskegon, Michigan, took me on and invested their time in me for about 3 4 days. Really taught me the ropes, ins and outs of how to do OASIS evaluations, and also daily visits, but also kind of trying to keep a pace about it. They're really good, really very structured. So I'm very thankful for that opportunity that they gave me.
Cool. Okay. So what attracts therapists to working in this setting?
I think the thing that people really in home health entices them about is it's one-on-one. We as therapists love to, focus in on our patients. And so many times, like in a hospital setting or an outpatient setting, you're interrupted, you're distracted by the things that are going on. But when you're with that patient in the house, it's just you and the patient. So one-on-one is great. Second thing, I think it's a little more autonomous. You don't have anybody looking over your shoulder. You don't have anybody saying, boy, this has to get done or not. So that's kind of nice. And the third thing I think is that you have control over your schedule. Somebody else isn't making the schedule for you. You are setting up the schedule yourself. So
Yeah.
that I think what attracts people to it.
Mm-hmm. Makes sense. What qualities do you look for that really make it enjoyable to work in a particular home health agency?
I've done it. I haven't really experienced a bad one, but I've heard about them.
Yeah.
I think the good agencies have their systems down to a science. And secondly, they have realistic expectations. So, first of all, they know how long it takes typically for somebody to perform an evaluation, daily visit. They know the radius that they're expecting you to drive. They know the territory that you want to be kept in. And then they have a great scheduling system to try to make it all happen. So if they have their systems down, it makes life so much easier. It's the companies that are maybe kind of starting out or aren't quite as organized that make life challenging for a therapist. So I think really having their systems down. And the other is realistic expectations. If a company knows what can typically be done in a day, and they kind of weight the visits, OASIS gets a certain amount, an evaluation and a daily visit get a certain amount. They're not trying to burn you out and use you up, but they know what's doable and what's not.
Mm-hmm. A well-working business.
Mm-hmm.
Everyone asks about whether it's better to be paid by the hour or by the visit. What do you think?
No easy answer.
Okay.
I think the safe answer is to say to be paid hourly, because you don't run into the risk of, you go to the house and somebody's not there because they forgot to tell you that they had a doctor's visit, or they were admitted to the hospital suddenly and they didn't call you or didn't call the agency and say, hey, we're not going to be there for the visit, or who knows, they just plain forgot and they left for some reason. So that you don't miss those visits.
Mm-hmm.
You get paid for your time just showing up at the door.
Mm-hmm.
On the flip side of that, though, if you have a tighter radius, like if you're working like within a 20 to 30 mile radius and you're really not putting maybe more than 40 miles in a day, I think the potential to get paid by the visit gives you the potential to make more money. So the companies are always going to want to pay you per visit because it makes sense. I mean, they don't have to pay for work that wasn't done.
Mm-hmm.
So, but there are pros and cons, and it's not really an answer.
Mm-hmm. Are there any differences between working as a contract therapist versus a direct hire therapist in this setting?
I think it's true for any setting you're in, but it's also true. Same goes for home health. And the fact is, you just get less training time. They want you up to speed as quickly as possible. So, for example, when at the same time I started at Mercy, I was up and running in 3 days, and the permanent hires, they took a week and a half they just gave more time. They wanted me up and running because they're paying for me. So they're paying higher. So I think the demands are a little bit higher. That's basically the only difference. Once you're up and running, they treat you the same.
Makes sense.
Mm-hmm.
Okay. So what do you find the most challenging about working in this setting?
One of the, I think the challenges is you're solo. It's one of the advantages, but it's also a challenge because you don't have anybody to bounce any ideas off of. It's just you. You're there, and somebody's like, I can't get in and out of my shower. It's not like you can pull the OT in and say, what you got any ideas here? That's you. That's it. The other thing is, by and large, home health is pretty documentation intensive. It's more than you think it is going to be. And so that's a challenge. And the third thing I think that's really a challenge is communication. It's not at your fingertips. I mean, the nurse isn't right there. The OT is not right there to bounce speech isn't there. You have to intentionally get your car or between visits or stop and call them, talk to them, whether it's the doctor's office, the nurse, or the other therapist you're working with. It takes more intentionality, which takes more time.
Mm-hmm. So communication is key.
Yeah. Mm-hmm.
Okay. So what qualities does a therapist need to excel in this setting?
I think a couple of things. One is you have to be comfortable with your therapy skills. You have to be competent. Mm-hmm. You're going into a house, you're running solo, so you have to be comfortable with who you are as a therapist. Secondly, you have to be comfortable with going into people's homes. It's the only environment in healthcare where you're on their turf. Hospital, outpatient, whatever the case might be, they're on all of a sudden patients on your turf. Now it's flip-flop. You're in their home, their environment, and it's more like you're a guest than you are a healthcare provider.
Which is a very
guest first,
different experience.
Very different
than in the hospital.
Third thing is I think you need to be organized. You have to be on top of your game because the documentation can just bury you if you're not efficient with the time in the home. So you have to organize your day, but also you have to be efficient when you're in the home. So those are the keys, I think.
Interesting. Okay, so do you have any tips for someone who's just starting out in this setting?
Like we said before, find a organized agency that has realistic expectations, number one. Number two, I think a key thing to do is make sure that you really nail down the processes for yourself. So that, in other words, you have their documentation system as much training as you can get. Because when you get out there in the field and you're in the home, it's just you. You're on your own. And then talk to experienced therapists because they will know, hey, when you're here, this is when you input this information, or I get the information here, and while they're doing, they can give you tips to make you much more efficient in the home. So do your homework and then ask for advice is huge.
Learn from the greats.
Yeah. And third, and the last one I would say is make sure you have everything before you leave the office. Because I don't know how many times I've been in the house where I go into my folder and I'm like, oh, I don't have that home exercise program. I'll have to give that to you next time. Or I don't have that paperwork you need to sign for the consent. It's like, oh. So organization, make sure you got everything you need.
Cool. I learned a lot. Thank you very much.
You're welcome.